What do you mean you can't see your doctor? That's absurd. Do you know what the craziest healthcare reform change I've seen is? No? Well, stick around because I'm going to tell you right now. How's it going, everyone? I'm Joey Gingola with Gingola Insurance, and on today's health insurance break, I have to be the one to tell you, unfortunately, that yes, this is correct. Anthem Blue Cross and Blue Shield has decided to no longer consider the Cleveland Clinic a in-network facility. As a result of the stipulations and guidelines and regulations and mandated whatever this, that, and the other, Anthem has come to the conclusion that they will be unable to offer that extensive network that they have really been known for. I mean, I said things were going to get crazy, but I didn't honestly think they were going to get like this crazy. I was kind of half serious, half joking when I said it, but this is getting a little intense as far as some of the drastic changes that are being made to meet the requirements of the Affordable Care Act. So why is Anthem giving up on one of their biggest competitive advantages? Well, if you are buying an individual health insurance policy in or outside of Ohio's health insurance marketplace, you will no longer be purchasing a plan that comes with Anthem's Blue Card. This Blue Card provided you the ability to easily receive treatment across state lines and throughout the country of their robust network of doctors and hospitals. The size and ease of use of this network was easily one of Anthem's biggest competitive advantages against other health insurance companies in Ohio. The plans that you apply for starting today, October 1st, and that take effect January 1st of 2014 can no longer make that claim. One of the biggest shockers of this network shakeup, if you will, network shakeup if I can use air quotes, it's that Anthem decided to hitch its post-healthcare reform wagon to university hospital systems. And excluding the Cleveland Clinic, the largest hospital system in the state, from its network. Just let that sink in for a second. So if you're sitting down in southern Ohio having yourself a laugh and saying, oh, those poor schmucks up there in the northeastern part of Ohio, well, they're screwed. Well, hey, it's coming back around to you because this is a statewide epidemic, unfortunately. If you live in the Columbus area, the Mount Carmel Hospital Systems is the one that Anthem has aligned itself with. If you live in the Dayton area, you can expect to go to the Kettering Hospital Systems. And if you're in the Cincinnati area, you can expect to receive treatment from the Tri-Health Medical Systems. That means if you receive treatment from any of those other hospitals outside of those ones that I just named in those areas, well, you're going to want to do some rescheduling or possibly hold on to your current Anthem policy for dear life. Also, just a disclaimer here, I have been told by Anthem officials that their provider lookup or their find a doctor tool is not properly updated yet. So you'll have to wait a few before you can actually go look for these hospital systems to try and find new doctors that you may or may not want to receive treatment from. Also, while we're throwing out disclaimers here, it is very important to note that this change will not impact your current Anthem policy, whether it's your own individual policy that you purchased or any health insurance that you currently have through your employer. These network changes are only going to affect the new Anthem plans that are sold inside or outside of the marketplace, with an effective date starting January 1st of 2014. Why Anthem? Why? Just why? That's probably the next logical question you're asking yourself, and it's a good one. So there are several theories floating around as to why this is happening. The biggest and most relevant one is possibly tied to the idea of keeping costs down. So if those hospitals are not willing to bend to Anthem's negotiated prices and Anthem is unwilling to up their prices based upon their counter offer, well, then you can kind of see where things get a little messy and we end up with a situation like we have right now. And my own personal theory, to a lesser extent, is it's possible that both parties have kind of failed to realize how important or dependent they are upon each other, especially when you have companies like Medical Mutual, what we talked about last week, that are not making any drastic changes to their network. So you can see that the first theory looks like it may or may not be all that credible. If you missed that video on Medical Mutual, you can go ahead and check that out right here. So, but I know you, and this is something that I feel, if I know you at all, that is a big deal. And you would gladly pay a decent amount of money extra for the right to see the doctors and go to the hospitals that you feel adequate. So we've got you all worked up. So the last question is then, what do you do? First off, it's going to be very hard to say what you should exactly do without knowing your specific situation. If you want, the actual best advice, feel free to reach out to me and I will gladly go over that specific situation with you. You can send me an email, joey@jingolainsurance.com, anytime. Be glad to hear from you. However, just a general statement, if you aren't comfortable receiving treatment from those hospital systems that are staying in Anthem's network in those cities, then Anthem should remain a pretty solid option for you moving forward. What's the bottom line? The bottom line is this is the biggest side effect of the Affordable Care Act that I did not see coming. This is going to create more problems than a government shutdown if you go online and try and buy your health insurance on your own without the help of a licensed agent or broker. When you start to consider your new Affordable Care Act options, the network is going to be one of the first questions that you want to ask about. Just knowing there's a huge difference between networks gives you a serious advantage during your first trip to Ohio's health insurance marketplace. If you want to give yourself even more of a serious advantage when dealing with Ohio's health insurance marketplace, well then I want you to go ahead and download our guide, How to Understand Ohio's Health Insurance Marketplace. This is going to give you all the detailed information that you need to know to make the best decision for your health insurance here starting now with these marketplaces newly open. You can go ahead and click on the cover of this ebook to go ahead and make that happen, or there is a link below in the video's description. So I do want to thank you for taking the time to watch this video. But as always, I am Joey Giangola with Giangola Insurance Agency. Take it easy, everyone.